So I'm from the Positive Speakers Bureau. So we work in the sector to enable people living with HIV to tell their stories to people like yourselves. We'll do talks with a number of places, a number of venues to talk about our stories of living with HIV. We encourage in these talks people to ask questions and facilitate conversations between people living with HIV and generally their healthcare providers on ways they can improve their services, as well as hearing about lived experiences. We do this with the hope of breaking stigma of our community and showing people that we're living healthy with HIV. I've been living with HIV since 2019. 18, I always forget the exact year, which I think is progress, really. But, you know, I was diagnosed in Nelson, in a small New Zealand town, or smallish New Zealand town, and my experiences of interacting with the healthcare sector at those beginning days were challenging and could have resulted in me breaking ties with healthcare. And we've just heard about all the great things that are going on in the world of HIV. And we want everybody to be involved and engaged so they can reap the benefits of their healthcare, of the advances. We'll do talks and discussions with polytechs, universities, you know, a number of anyone that wants to listen. This is some of the feedback we've had on our speakers. So one of them is actually in the room. I haven't told him this is happening, but he's in the room, so you can try and find him. So this presentation was hugely eye-opening, and I feel extremely privileged to have had the opportunity to hear X and X. Actually, they're both here. I feel like not only has my knowledge about HIV improved, but my empathy and understanding towards those people living with the virus have reached a whole new level. I believe education is the way forward to eradicate stigma and judgment, help provide better care and support to those in need, and help reduce rates of transmission. From my interaction with the Positive Speakers Bureau, I couldn't speak more highly of this organisation and their sessions. I've gained so much from this as a medical student, and I believe any person from any background would also benefit. And the feedback we get from most of the sessions is on that same sort of note. People don't understand or haven't heard the changes. I mean, you guys are obviously interested, so you probably are well equipped. But I did a talk literally 3 weeks ago in an urgent care setting in Nelson, and they hadn't even heard of the concept of PEP, let alone understand how to access it. And these were doctors and nurses. So, you know, it's really great to hear that things are changing, and the PEP and PrEP lady's gone, that the guidelines are changing, but there's definitely work in the space of getting it out there into our community. Another feedback. Does anyone from the community want to read these out as well? Because it's probably important. Anyone want to volunteer? No? Yep. No? I've heard multiple things about you. Rodrigo, you want to read one of them out?
Sure. Really incredible. Both were incredible speakers, and the information I got was actually nearly entirely new to me. Super grateful for the opportunity to hear and speak.
Cool. Yeah. So the next one, so what an amazing presentation, and it really exposed all of my prior beliefs around HIV, as well as corrected so many statements. I thoroughly enjoyed the presentation, and it was delivered on a bigger scale and wish it was delivered on a bigger scale more frequently. It's so informative, thank you, blah, blah, blah. And really commend their bravery to share their story with 70 students who they'd never met. I found it really beneficial to listen. So when our speakers go out, they give a bit of themselves to the audience. They'll talk about a really personal moment in their lives, and they're offering up a bit of themselves to the people that are there. It's a really powerful event for not just the people listening, but the people delivering the talks. For me, as someone living with HIV, it's been part of my journey of acceptance. When I think back to 2019 or 18, whatever year it was, I wouldn't think that this possibility was ever going to happen. And then I began working for the PHO in Nelson, and I stumbled across Jane one day in the office, who got me to go to the training course, and then 6 months later I applied for the role as the coordinator. And it's, connected me with a community I wasn't engaged with. So the value in the PSB is twofold, in education and for empowering people in our community. Cool. We have some really cool learning tools in our sort of repertoire that we encourage people that attend talks to undertake. So we have HIV Essentials, which is a learning module. It's interactive. It attracts 2 CDP points or 2 hours of learning, depending on which organisation you're part of. That QR code will take you to it. It's also available through the Kawatia Learn website and Health Learn, as well as on our website as well. So we really encourage people to do that module. And we have a short quiz as well, which helps people understand their knowledge gaps, really, and points them in the right direction of learning things. So we've had just over 1,300 people complete the quiz, and I have just over 1,000 people complete the online essentials module. Cool. Oh, gone the wrong way. So I guess the last question that we have is, how can I book a speaker? You can do that through our website, and also by scanning the QR code or emailing us directly. We have a booking form on our website that you can fill out, and it comes through to us, and we'll arrange one of our speakers to come and speak in whatever setting that you would like. Yeah.